In this video, I'm going to show you how to use a training softball to release your psoas muscle if your psoas muscle is a little tight or has some added tension into it. So I'm using this training softball. If you squeeze it, there's a little bit of squish to it. You can find these in most sporting goods stores. You just want to make sure before you buy it that it actually has some give to it. You do not want to use a traditional training softball. That would be too hard for your psoas muscle. Additionally, you might consider using some of the smaller pinky rubber balls that you might use to release other muscles, and that's going to be too small to access your psoas muscle because we're working within our trunk. So what you want to do is lie. If I want to treat my left psoas, I'm going to lie on my right side so that all my viscera and organs can slide out of the way, because the psoas lies in the back wall of your abdominal cavity. And then you're going to choose a spot. If you use two fingertips to find your hip bone in the front, that's called the ASIS. You're going to go in about 1 inch and up 2 inches into the lateral side of your abdominal region. You don't want to be too high because that's going to get into your ribs. So you want to make sure that you avoid any bony prominences. You also do not want to be too close to your navel because you have a large your aorta, a large artery that runs down just the left side of your navel area. So I'll show you what that means if you happen to roll onto it. So you want to stay lateral outside of that. So once you kind of determine balls on my hip bone, roll in about 1 inch, roll up 1 inch or so, and then slowly roll on to the ball. And then once you're there, create a pillow with your hands so that your head can rest into it. And then you can kind of use your forearms into the floor like an army crawl to kind of, again, seek out where it's most tender and tight. If you feel a throbbing in your abdominal region, that is likely coming from pressure being placed on the aorta. So you want to roll off of that. Do not put pressure into that aorta. And so I'm gonna spot right about there is where I feel some tenderness. And that takes a few moments to allow your body weight to rest into the ball so that your soft tissue can kind of drape itself around it. And this may be enough to start with. So you can hang out here, breathe and relax your body weight for about 1 minute or so, no more than 2 minutes. If you're not feeling much of pressure through here, once you relax, you can slide your opposite leg out to the side a little bit in a slight figure 4. And what you notice is that will roll my pelvis back onto the ball, because if I'm here, my pelvis might roll off. So if I bring my knee out to the side, it will roll my pelvis back onto the ball, putting some more pressure. And then hang out there and breathe into it. The exhalation phase is really the crucial phase for your body to really relax over the ball. If you're holding on to any tension, you're not going to get the full release into that psoas muscle. Certainly if anything's too tender to the pressure, you need to adjust and roll off a little bit, because you're not going to get your relaxation response that you're looking for. So it needs to be tolerable. When you're ready to come off the ball, again, no more than 2 minutes, 3 minutes tops, you're going to bring your leg back down. You're going to slowly just roll off just enough to get the ball out, and then let yourself rest on your tummy. You can do a little tail wag so that the organs and viscera can return to their original position and can let that psoas muscle just chill out for a moment before you roll to your side and then come up to a seated position. The reason why I instruct you to come out like that is because after the psoas has just had this deep pressure to release it, you don't want to jump out of that position and risk spasming that muscle after it just had this really deep release. Thank you so much for watching, and stay tuned for more videos on how to release various muscles.